extremely interested in and focused on smoking cessation and the implementation of smoke-free public housing. Historically, we've worked with health centers, and we are a Training and Technical Assistance National Cooperative Agreement holder from the Health Resources Services Administration of the U.S. Department of Health and Human Services. The opinions expressed are those of the National Center, though, and not necessarily those of HHS. With me today is Dr. Jose Leon, who will handle the bulk of the discussion today, who is our Chief Medical Officer. And I'm going to ask each of the folks on the phone if they wouldn't mind to please introduce themselves. And when you do, please explain briefly what you hope to gain from participation in the Learning Collaborative.
Hi, my name is Maria Sanchez, and I work for San Isidro Health, and I manage the mobile health services. And what I want to gain is how to best collaborate with public housing sites and supporting them in their efforts for a smoke cessation.
Thank you, Maria. Thank you for being on the call.
Good afternoon. I'm Bridget Pryor with Albany Housing Authority, and we've implemented the program smoking not in our unit since January of 2016.
Okay, very good. Glad to have you with us.
Thank you.
And my name is Jeannie Orr. I'm with the Capital District Tobacco-Free Communities, and I actually work with Bridget to help Albany Housing go smoke-free. We're funded by the New York State Department of Health, and we work with other public housing authorities as well, and trying to assist the residents there in quitting or managing their cravings.
Excellent.
Good morning. I'm Barbara Willis with Hampton Roads Community Health Center, and we operate a health clinic on the property of the largest public housing unit in the Commonwealth of Virginia, and so we're interested in connecting with our residents and helping them with the changes that have taken place concerning smoking on the public housing campuses.
Oh, perfect. Glad you're with us, Barbara.
Do we have anybody else?
Yes, my name is Pamela Jones, and I am the Marketing and Outreach Coordinator also at Hampton Roads Community Health Center. And as Barbara Willis just stated, definitely supporting the cause and making sure that public housing and the engagement created around the marketing and the content is supported, and also in the best way to connect with public housing in the area. So,
well, glad you're with us. Communication is a big part of this whole effort.
Absolutely.
And good afternoon. My name is Brenda Lawrence. I'm with Hampton Roads Community Health Center as usual, also, and we're here to represent. We're going to support, inform, and give resources to one of the largest areas in the Commonwealth. We're here for them, and we're here to get information.
Perfect. All right. Okay, let's go through the agenda. Sure.
Well, thank you so much for joining us this morning or this afternoon, depending on where you are. This is the agenda for today's Learning Collaborative. First of all, we will do an introduction, and then we would like to hear from the public housing agencies about the needs and challenges that they face during the implementation period. Then we would like to hear from the health centers, specifically the smoking cessation services that they provide to the patients, how they are working with the community, as the public housing agency or any other community organization, and the collaborations between public housing agencies, health centers, or any other community organization. And then we are going to briefly discuss some of the ideas that we have, some of the organizations that we are planning to invite, we've been working with several organizations, the American Lung Association, American Cancer Society, the Centers for Disease Control and Prevention. We're working with HUD. We are working with
National Council on Behavioral Health, the Smoking Cessation Leadership Center at the University of California, San Francisco, and a number of other groups.
So
the Truth Initiative.
They have different resources. They have different ideas that they would like to share with all of you. So this is going to be an interactive activity, not only between health centers and public housing agencies, but we are going to have organizations who will be providing smoking cessation services for the communities that you serve. Now, just a very brief introduction for those who are not familiar with those living in public housing. There are around 2 million people living in public housing, and the average household number is around 2.2 people per unit. One of the characteristics of this population is that you have vulnerable populations living in public housing. Around 16 to 17%, I'm talking of, these are nationwide numbers, are seniors over the age of 65. Around 38% of those living in public housing are children. And as you know, around 80% or over 80% of them are at or below the poverty line. So this is something that I believe is very important to know, specifically for those who are not familiar with the population. There are other numbers that we would like to briefly discuss. There are two very good publications from HUD. The one that we are going to present some numbers from is the Health Picture of HUD Assisted Adults from 2006 and 2012. And these are numbers that show the needs, the healthcare needs of those living in public housing. Around 36% of them reported that they have either fair or poor health. And when you compare it to the adult population in the United States, the numbers is probably twice, a little bit over 2 times the number of patients that report fair or poor health. The numbers of those living in public house in HUD-assisted HUD programs, 71% of them are overweight, 61% of them have a disability, and around 17 or 18% have diabetes. Now, in regards to some of the diseases that are associated with smoking cigarettes, you have that around 14% of those living in HUD-assisted programs have a COPD, and over 16% of them have asthma. This is a very important number that more than 1/3 of those living in public housing are current smokers. And when you compare it to the adult population, the U.S. adult population, the number is 1 time higher. Now, this is a slide comparing the number of those who smoke in the United States versus those who smoke in public housing. And the number is 2 times higher for those living in public housing. Now, I believe that this is a slide that Bob mentions when he talks about this topic.
You know, right now, and for the folks who are health center, leaders, diabetes is the cause, I think, that the Bureau of Primary Health Care and HRSA is most focused on. And some of you may know it, but in the United States last year, 80,000 people died from diabetes-related illnesses, whereas the number who died last year from smoking-related illnesses is 480,000. Another statistic which is equally troubling is for every person who dies, there are 30 others who have some kind of smoking-related illness, which comes out to about 15 million people nationally impacted by cigarette smoking. Now, back to the 480,000 folks who die every year, about 41,000 of those die from secondhand smoke. Just horrendous. And of course, the smoke-free ban was designed to address, some of those secondhand smoke issues. And yet, when you come back to the fact that a third of residents of public housing are smoking cigarettes, it's just an incredibly bad situation and one that needs to be addressed. And in talking to the group, I guess I'm going to throw something out now, which we can talk about later as a group. But I think a lot of people in healthcare get frustrated in treating tobacco disorders because it is so difficult for people to quit. And one of the things we're hoping to get at here is, of course, we want to help housing agencies implement the smoke-free ban, but we really want to get to smoking cessation, just because it's such a devastating illness in terms of death and disease. And so we can talk a little bit about that, later on. But in any case, the smoke-free rule, most of you are aware, it was implementation began, I guess, in 17 in February with once the Trump folks approved what had already been done in the previous administration, and then actually everybody is supposed to be smoke-free now as of August 1 of 2018. And we'll talk about a little bit more about how that's going in a few minutes.
Thank you, Bob. And as Bob mentioned, on December 5th, HUD published the final rule requiring all public housing agencies to initiate a smoke-free policy. The rule was effective on February 3rd, 2017, and the rule had an 18-month implementation period. Now, this we would like to talk a little bit about what health centers are doing and what the tobacco cessation support strategies they have. We've been talking to health centers in regards to this particular topic. We have different ways that we have talked to the health centers. Specifically, we conducted a survey and we asked them what kind of services they are providing for those who are trying to stop smoking in public housing. And health centers in general have on-site smoking cessation services. They have they refer patients to the quit lines when they do not have the smoking on-site smoking cessation services, and they offer behavioral and pharmacological interventions. So the health center in the community is the best place for public housing residents to go and find support for specifically they are trying to stop smoking, and if they have any other chronic medical condition, so they can be addressed at any of the clinics that are in the community. Now, before we continue, I believe that is as part of the agenda, we would like to hear from the public housing agencies about their experience with the rule. I understand that some on the call probably were smoke-free before the rule was implemented. So I'm going to open now the conversation to the public housing agencies so they can share with us the needs that they faced, any best practices or any challenges that they had during the implementation period.
Yes, this is Bridget Pryor with Albany Housing Authority, and we did get a jump on the rule, partnering with Jeannie Orr, who's with the Capital District Tobacco Coalition, as well as other partners in the area, the Albany County Health Department. Jeannie, if you want to jump in, and the Asthma Coalition, all the local health departments, not health departments, but the clinics around such as our local Whitney Young, St. Peter's Hospital. So it was a lot of different partners and a lot of people around the table to help us implement this initiative, as well as we had our own unique type of thing with the we had a reverse trick or treat to educate the residents. We had a lot of information going out in the bags with our partners. We also did a lot of informational meetings with them to let them know prior to when we were going to do the kickoff, so no one was taken by surprise. Everyone was informed. We got feedback from them. The only big pushback when we had the informational meetings, I felt, was the seniors. They weren't, or they didn't want to comply. They just felt that this was one more thing that they had to give up, and they felt that they were giving up something, even though we continuously said that they didn't have to stop smoking. They just couldn't smoke in our units. So once that happened, they were able to voice their opinion. Again, as I said, they had time, and we were there for support or any questions that they had. So I think it was a smooth transition because we started so early, and with the partners that sat around the table to help us implement this initiative, as I said. Jeannie, if you want to add anything.
Yeah, it was a really good campaign that we sat around and came up with a campaign called We Are Free to Breathe, and try to make it very positive, that this isn't about, no smoking, we don't want smokers, anything like that, but, it was really about making a place where everyone could breathe freely in their homes. But, having said that, though, there are still issues, and I'm sure you would agree, Bridget, of people not complying with the policy and things like that, although generally when we did do that reverse trick or treat, people were, they did express that, oh yeah, that's good, I'm glad, because it's going to push me to quit, things like that. But we know that smoking is an addiction, and it's really difficult. We recently did a what we called a Breathe Easy Cafe at Albany Housing in one of the developments, and we invited smokers and non-smokers to come and talk and share their story about how smoking has affected them. And we got some powerful stories of people saying it has a grip on me. And even with the inconvenience of having a no smoking policy, people are still smoking, and sometimes indoors, sometimes not. But it is difficult, and it just shows how what a horrible addiction is. One person said to me, actually to the whole group, because we were sharing stories out loud, and that was the whole purpose of this event. She said, I quit hard drugs 25 years ago, but I can't quit smoking because it has that hard a grip on me. So, I would like to hear what more we could be doing, where we actually just started a quit smoking cessation group there on site. This past Monday was the first one, but it was very low turnout. Again, even though there are people who say, yes, I want to do it, to actually get people out to do it is another story.
Excellent. Thank you so much for sharing your experience. I have a follow-up question in regards to your Free to Breathe campaign. Specifically, which or what members of the community or organization were involved in this campaign?
And I think Bridget had mentioned a lot of them, like the Albany County Health Department. So the Commissioner of Health was there around the table. We had American Cancer Society. We had CDPHP, which is a big insurance company in the area. We had the Healthy Neighborhoods Program, and the Asthma Coalition, and then us, which are the Capital District Tobacco-Free Community, St. Peter's Health Partners, which is like the largest health care provider in the area, and then Albany Housing. Can you think of any others, Bridget?
No, I think that covers it.
Yeah, I think that's it.
Thank you.
And we called it the Healthy Living, the Healthy Living Partners, because we thought in the future we could always reconvene to work again.
And who are you working with on the Quit Smoking Cessation group? Who is leading the effort?
My group, along with another group that's funded by the New York State Department of Health to work with healthcare providers to put systems changes in to help people quit, called Health Systems for New York, and we're called the Advancing Tobacco-Free Communities, both grant funded by the Department of Health, and also with what's called the DISRIP group. It's Medicaid. We're trying to redo Medicaid so that it's much decrease the use of people coming back. So it's called DISRIP. I don't know if you're familiar with that. I can't remember what exactly it stands for. Delivery something systems. But they are also working on some tobacco issues in our area, so we're working together on that.
Okay, thank you so much.
Can I ask you how much time you spent just coordinating activities between the housing agency and the health center and some of the other partners?
Do you mean for the rollout, or do you mean
to
for
put it all together?
It was a year.
How much time? Well, that's hard to say.
I think it was a year. Like when we started talking initially, when we did the Halloween with the trick or treat, that was in October. Yeah. But there was also different meetings coming out prior to probably September.
Right.
So I would say 6 months to a year.
Okay.
It was actually right around 6 months because they did it pretty quickly because at the time I think he announced it in August and
right.
It was smoke-free in January. So it was really fairly quick turnaround, but we crammed in a lot.
Right. And can you explain a little bit? I'm just not familiar with it, but the reverse trick or treat?
Oh, that was the executive director's idea. Do you want to explain it? Or do you want me to?
No, that's where we, for Halloween, went to two of our community, our two family sites that we have. Yep. And along with our partners and two of our staff managers dressed up as a cigarette, other people dressed up in different costumes. Yep. And in that bag, as Jeannie pointed out, that the campaign, it said, "We are free to breathe." So on one side it said, "We are free to breathe," and on the other side had our partners that were helping us do the initiative. And in the bag it had information about the cessation classes, the importance of trying to breathe freely, and also the initiative, as well as a lot of swag in the bag, healthy snacks, frequent asked question flyer, just everything pertaining to the initiative in the campaign.
Right, and it was very well received. I was one of the trick-or-treaters that night, and the kids were coming around, swarming around us, and I was dressed as a witch, and they really appreciate it because it wasn't like saying, come to this thing. We went to them with a bag for every person, a reusable shopping bag, and one of the people who went with us is an asthma educator at Albany County Department of Health. Yep. So she also talked to them a bit about asthma and asked, "Hey, do you have anyone who has asthma?" Well, we have information for that, and so it was a way of giving back instead of saying this is a bad thing, this is a good thing. We're just trying to improve the health and doing something that people I think appreciated.
Very good.
And I just want to add that we went door to door to two of the sites, so it was like 350 units that they went to. Door to door.
And then the rest of the units that we didn't go to, I think the bags got distributed to those places, right? Isn't that what happened?
Right. They were actually at the meetings that we had, and also I delivered door to door to our 2,000 residents, to the senior buildings, to the high rises that we have that's intergenerational. So everyone got a bag with the information in it.
And you said you distributed bags and healthy snacks and stuff as well. So, I mean, how much did this all cost you?
Oh, well, some of the swag came from our partners, like different items that they had in there. The apples, I can't really say. I know we purchased the bags, so I can't really say.
Yeah, I think it was a lot of different people handed out like pens and other little, things like that.
Okay.
Right, a lot of things were donated.
It sounds really good. Hey, and in terms of your kind of overall coordination, now have you guys been working closely with your state tobacco control and cancer control as well?
Right. Well, I'm funded by the New York State Department of Health Tobacco Control Program. We're a community organization, and they fund. Yeah, so definitely.
Okay. Gotcha.
We cover every county in the state. Like there are different organizations that cover every county.
Okay. Yep. That makes great sense. And do any of you guys work with the Primary Care Association in your state?
Yes, there are health systems partners that do that in the state as well. They work with the, hospitals, primary care providers. Yep.
But do you work with the Primary Care Association itself?
I don't know about the association.
Okay.
I'd have to ask my partner about that because I don't do that work.
Well, the Primary Care Association, each state has a Primary Care Association, and they're basically the organization in the state that kind of represents and provides training and technical assistance for the health, the federally qualified community health centers in the state.
Okay. Yeah, I'm not sure. They probably do because they do work with every federally qualified health center.
Okay. It's very good. It's just they're a good group to tap into if you're trying to approach something on a statewide basis, because they can kind of help with some of that communication and coordination piece.
Mm-hmm. Good to know. I'll pass it on.
Go ahead.
Right. Thank you so much for the feedback and best practices. Any other one from any of the public housing agencies on the call who would like to share their experience?
Or any of
Well,
them?
here in Virginia, we had an outreach event at each public housing. This is Brenda with Hampton Roads Community Health Center, where outreach was present, and our chief medical officer was present to speak to anyone who was interested in smoking cessation and to pass out information to inform them and connect all of the resources. We covered all of the public housing units, all of the public housings collectively at each event so that they would be aware that the information was available for them.
How do you coordinate the outreach event? Do you have agreements with the public housing agency, or is that something that you are doing because of the HOTS rule?
Each of the cities collaboratively met and became one entity.
Right.
And Brenda, I'm curious, in terms of the population of residents at the housing agency or housing agencies, what percentage of the residents would you say are patients of your health center?
I wouldn't have that information, but we're currently tracking, and everyone is trying to make sure that everything comes together before we can really see what the outcome is going to be. But the main thing was to get out there, let them know that what was available to them.
Yeah. And if they've got any residents who are having trouble just making the switch and not smoking in their apartments, are they referring any folks directly to you for assistance?
They are, and we have some of our sites have on-site collaboratives, or we have on-site clinics where they can be seen. One of the largest here in Virginia has an on-site clinic that is sponsored through us, which is called Communicare. So they were one of the big sites that we went to speak to everyone.
Okay.
Word travels quickly, trust me.
Any other challenges that anybody, especially on the public housing side, has really experienced over the last, either in your initial introduction of smoke-free, if it was prior to the rule, or if you've had any challenges since it was you must stop smoking in all units directive?
As Jeannie mentioned, it's an addiction, so people didn't go, quietly into the good night. They had to be, you know, coddled or, still it wasn't like you're smoking, you're out, and we definitely was not the smoking police. But if it came to our attention, we, brought it back like just a quick reminder in the first 6 months. I don't know if you know it or not, but we do have a non-smoking, smoke-free building. These are the, again, gave them the rules and the regulations. Second offense, if it's still a same per person, a little bit more stringent on the rules and regulations, and then even enforcing a fine. And then after that, the third offense, it hasn't come. I think this has been one case where they went to court for an eviction, but again, just gentle reminders.
Wow.
I don't know the outcome of
the eviction
because I don't know the outcome of that, but we've been in play since for 2 years. So now we're in the enforcement stage because in 2 years you should know the rules because we plastered the buildings with all the information that this was coming. We even had banners as of January 1st that put on all the buildings that were smoke-free. So it was nobody, unless you were on another planet, there wasn't any way that you could not know that this was going to take place.
Yep.
So, again, I don't know the status because I'm not a manager, but we that was one of the things that they told the staff because we also went through training with the staff for cessation classes too because we have staff that smoke. So it wouldn't be a good look if we're smoking on the property and we're telling the residents that they can't, where they live, that they can't. So staff was also had informational meetings and also to be aware of the initiative.
Wait, I'll pass along to you guys. I mean, there's a health center that we work with, and the director there was so committed to smoking cessation and smoke-free that he basically made a decision that if you wanted to work at the health center and you wanted to be insured by the health center, you couldn't smoke anymore. And so over the course of a couple of years and a couple of hundred employees, I think they only had one person who was unable to successfully stop smoking. But it was really just, I guess, a sign to the employees and to the patients that they were dead serious about smoke-free, and they're living it every day. And so far, it's worked pretty well.
Any other public housing organization who would like to share their experience, best practices, challenges before we move on? All right. What about the health centers? We heard from our friends in Virginia. Any other health center who would like to talk just briefly talk to us about the services that they are providing, the outreach activities, any campaign that they have been involved with the public housing agency?
Can I ask, is anybody using any incentives to encourage people to stop smoking? Anything at all? We've talked to a few folks who actually offer cash to get people to stop smoking. For a period of time, or what they do is they might, if they've got a group, they can all participate in kind of a lottery, and if you successfully quit smoking for a period of time, you get to put your number in, and you might be one of the, one of the folks who divides up the pot. Might be $100 or $200 or even up to $1,000 if you get enough people in the drawing. Anybody doing anything like that?
No, this is Elizabeth Teague with Daughters of Charity in the New Orleans area.
Yeah.
And we have 10 community health centers, one of which is actually designated as, we're across the street from the old, well, I call it the old Desire Projects because Katrina wiped them out and it's coming back, but it is a designated health center for that public housing area in the city of New Orleans. But the biggest response we have had in getting people to come forth, and this is from our counselors that run our program for tobacco cessation, and we've got our information, of course, in all of our sites, and we've got it on our website, and we also, do every so often drops into the neighborhoods because we have permission to do that from the folks that are managing the properties, et cetera, is training, a real intense training of our providers, because the folks that respond the strongest to tobacco cessation are those that have had that crucial conversation with their provider. They come in and they, of course, have been asked so many different times, if you're a smoker, and then that provider has actually zeroed in on that behavior as part of the wellness exam or the illness exam, depending why the person is there, and has had that discussion with somebody and then referred them through our PCCs within our clinics to get them involved in our programs appropriately and with the least amount of expense possible, preferably free with some of the programs that are there for people. So that's been the most successful.
Now, after the initial conversation with the provider, you get their attention. What is the next level of service or counseling or whatever that's been successful for you?
Well, once that happens, there would be like a referral written for the patient care coordinator to follow up with this individual and see about, encouraging them to either, again, whether it would be individual or group, or everything is a little bit different, you might say, depending on the patient.
Mm-hmm. That makes sense.
And so there is more than just, but the strength of that discussion. And so there's a very, very big, all our providers know that people should not be smoking. It's unhealthy, all that. But to understand the power that they have over that behavioral point of that person actually, okay, I'm gonna do this now. It's very, and there has been some data to this effect, but very, very telling, you might say.
Have you guys done anything with your providers to train them in motivational interviewing or any other techniques to actually stimulate? Because it all comes down to behavior.
Our counselors, and unfortunately, our counselor who heads this up, Dino was going to be part of this, but he's got his own challenges right now, and I told him I would sit in and bring him information after this. He does this on a one-on-one basis because that's the best way to do it with the doctors, with the nurse practitioners that are handling this with people, and with our adult providers, and sometimes with pediatric providers as well. Because of the age at which people sometimes do start smoking. And so, and that's a whole different way of looking at things. So we usually have our LCSWs and some of our psychologists working with our doctors and nurses to let them know what some of the scripting might be that they could use with people.
Okay, yeah. Perfect.
And almost like a warm handoff then to the department that does that, because again, community health centers have the integrated staffs and the integrated care that can take care of that sort of thing. We're a little bit different than just a doctor's office in a community.
Yeah. You know, we've been working with some organizations, specifically Harvard University and other colleges and universities, and they've been doing some research on the resources, specifically at the health center level. And they've been trying to find out whether health centers have certified tobacco counselors. So is the counselor that you are mentioning is a tobacco?
Yes, he is. Because we also had that. We have the program here that we do get people into. That's the free program that's paid for already. Of course, it's age dependent too.
Okay.
Okay, can you tell us a little bit about the background of the counselors that you're using?
I don't have it in front of me at the moment. No, but they did. Sometimes they're LCSWs, sometimes they're a psychologist.
Yeah.
It just depends on kind of what they're. A lot of times it's somebody who already is in the social services realm, and they have taken the special trainings.
Interesting. Okay, very good. Are you so you're using all professionals then in that regard? Are you using any kind of non-professionals, community health workers or peer counselors or peer specialists or anything like that?
We do have, and just started this year, we have a cadre now of community health workers that are working out in the local communities. However, right now, they have more of a generalized focus. And so if a need would be to, keep a person coming in on a regular basis or whatever, perhaps they might be engaged to do that on a specific person's, benefit. But we don't have a cadre that does it specifically for this program. It is something to think of, but then again, we'd have to worry about where we're going to get the money to do this. We actually are a pilot site, one of two in the nation, for United Healthcare right now with our community health workers.
Excellent.
Just started this year.
Okay. And as far as the effort with the housing, how closely are you working with the housing agency in New Orleans?
Well, we work very closely, mostly again specifically with the one that's right there at Desire, and we go to their meetings that they have, and we've got permission to take information over there. We usually do 2 or 3 food giveaways in combination with health fairs, you might call them. We're going to be coming up on another one. You always try to do one in the fall, close to Thanksgiving, and we pay Second Harvest to come in and bring the food in along with the stuff that we do as well. And then again, they give us permission to, get that information disseminated, because again, communicating with the audience is always the biggest challenge with any of our audiences, and so the ability to put something on a doorstep as a little door hanger or something like that, we've got permission to do that, and that really is very helpful.
Outreach is effective.
I'm sorry?
Oh, I was saying the outreach is effective.
Yes, and we have used the community health workers for that piece. We've gone in and taken stuff around, and the community health workers do go to their meetings. And again, meetings, it's interesting, they're not really all that well attended, and that's why the concept of a door knocker, or a door hanger, we don't knock on doors, but the ability to hang something on a door if people are out talking to them in their front yards and keeping moving is very effective.
Okay.
Almost like politicking. We're politicking up and down the streets, okay?
Well, it sounds like, you had it sounds like you've had a long-standing relationship with the housing authority.
The clinic has not been there that long,
yeah.
but we had a very close relationship with this particular neighborhood. Because of the nature of the one community health center that we do have there,
Yep. Now, for the rest of the folks on the phone, I'd just be curious and to hear from maybe first the public housing agency side. how much of a relationship do you now have with your community health center or your Department of Public Health? And is that a change, focused on smoking cessation and smoke-free, or is it something that was ongoing?
It was something that was ongoing here at Albany Housing Authority. We've always prided ourselves to be a good neighbor and to partner with all of the providers in the area. So like chronic diseases, we make certain that any information that needs to be going out to our residents get out through, for Albany County Health Department. Any initiatives that they're taking, we make certain that, again, we distribute all the information that they have so all of our residents will be able to take advantage of those services.
Okay, very good. And I think we just heard from New Orleans, pretty extensively, but from the health center side, I guess, do you have ongoing active relationships, with your public housing agency, or is it limited?
This is Barbara Willis. We're in Virginia, and we have a really good relationship with the authorities of the public housing program, and ours has been sporadic as different needs have been identified, and also just we also have had a manpower issue in terms of being able to stay consistently in front of the public housing residents, because what was mentioned with regards to some of the other talks about having the door hangers and being able to distribute on a consistent basis, we had been using their newsletter as a vehicle to communicate with residents, but the newsletter is so packed with information that don't really see that as being as effective as if we were able to canvass the areas a little bit more. So, but the administrative side has been extremely supportive of our presence, and we still look for different ways that we can collaborate together. And the smoking cessation piece that we're looking at now, we also have developed a relationship with our partner through our medical school, and so with them and I think a couple other entities, we're trying to come up with a way to be effective in getting the word out and marketing to the residents about smoking and helping, giving them tools for prevention. A piece that becomes important is the cost associated with, okay, because everyone, we can't hypnotize everybody, and so, paying for, who's going to pay for, the patches and different things like that that can assist folks, that becomes a challenge. I mean, we can talk to the folks, but then the next step is where I think that we need to come up with a way to bridge that gap for this to really be effective.
Yeah, very, very good. In fact, when we've done a lot of work with some different partners, and in fact, the American Lung Association actually was pretty good. They put together a pretty good matrix on Medicaid reimbursement for nicotine replacement and other treatments on a state-by-state basis. So if that's helpful to people, we could kind of get that out to folks if you'd like us to. Or not.
Yes, I am definitely interested in that. This is Pamela Jones with the Hampton Roads Community Health Center. I'd be interested in seeing that actual presentation.
Okay.
I'm not sure if I'm added to the actual email list, though. So would you like me to send it to you via email?
Just send email to jose.leon.
Send it to jose.leon on namgt.com, and I will make sure that you get that.
Awesome. Thank you so much.
You know, and one question I have too, and this kind of goes both ways as well, and Jose's looking at me because I realize we're getting close on time, but and it is sharing of information between the different partners, between the housing agencies and the health centers and the departments of public health. In terms of getting information out to, you know, to residents and neighbors and so on, and I guess specifically residents in this case, you know, if the health center wanted to get information out to the residents, you mentioned you hang stuff on the door. Do you also kind of share, you know, emails or phone numbers or mailing addresses or names, or is it pretty much all just based on, you know, you give them access to the building and people can leave information at the door kind of thing? Anybody?
I believe we go to the source, which is the property managers themselves of each facility. Yes. The property managers would distribute the information and or hold meetings and or set up events so that the information can be distributed. That is what has been happening like the whole month of August and before then. So the people the residents were well informed as to what was going to happen, what to expect, where to get help, how to get help. The word is out there. The information is out there. So now it's up to the resident to put those things into place because they have been informed here in Virginia because I've been a part of watching it happen.
Mm-hmm. Mm-hmm. And I'm curious from the housing agency side, when you do your your annual meeting with residents, I mean, I would assume that smoke-free came up, and I'm wondering when you have that discussion, is there any discussion around whether or not a resident has a health care provider?
Unfortunately, at all the annual meetings that I attended, and I've been here 25 years, attendance is very poor.
Yeah.
To the fact that if you get 10 people in the last couple years, we only had one person. Oh. So, and that person was favorable because they had asthma, so they were pro smoking in the unit. But other than that, any other type of feedback that we had came through surveys, and you were discussing initiatives. And one of the initiatives that we had to return the survey was that you would be in a drawing to receive a flat screen TV. So we had not all, but quite a bit of feedback when that was happening. Most of it, I don't know. Jeannie, can you speak on that as far as the survey and how people received it?
Yeah, unfortunately, the survey was done, I think, right after it went into, the policy went into place. And so it was kind of, I think some people felt like, well, it's already been done, but we still wanted to get their feedback. But we did also get the feedback from staff, too, and I thought that was important prior to going smoke-free to hear their concerns, because that's a big part of making sure the policy sticks, that the staff who are smoking, and there are quite a few smokers on staff, that they know where to get assistance and that they're behind the policy.
Mm-hmm. Mm-hmm.
All right. Well, thank you so much for all the information. I would like to briefly talk about next steps. We are planning to have these conference calls every 2 to 3 months. As I mentioned in the beginning, probably will depend on the people that we are planning to invite and their availability. But one of the things that we definitely would like to discuss with all of you is about the CDC Tips Campaign. CDC has some resources that are very, very useful, not only for the patients, but in general for the public housing agencies and the health centers. They have videos, they have fact sheets and posters and all kind of resources that I believe are very useful for everybody who is involved in this initiative. So we are planning to have somebody from CDC and talk a little bit about Tips Campaign, probably from the other agencies, but the idea is to have these conference calls at least 2 to 3, at least every 2 to 3 months. And at the same time, we are going to have email communication. We are going to share resources, and anything that you need from us, from the National Center for Health and Public Housing, please feel free to send me an email, and we are going to make sure that you receive any kind of information that you need. Just briefly, I'm not sure how many of you are on your computer right now, but this is the kind of videos that CDC has put in place. I am quite sure that you have seen some of these on TV. Specifically, if you see some of the sports events, they have some of these videos. So this is just an example. This is a 30-second video. Just give me 1 second while I play it. So this is the kind of resources from CDC, and I'm quite sure that you are going to find some interesting resources that you can give to your either your patients or your public housing residents. And again, it's been a pleasure to be with all of you on this call. Thank you so much for your participation, and you are going to hear from us soon.
And I'll just add one thing. If over the next couple of months, if you identify a best practice or a challenge that you're really concerned about, please, everybody will have everybody's email. We'll kind of send out an email list, and we can kind of share that information. And also, from the health center side and indirectly from the housing agency side, if there's something that you would like us to bring to the attention of the Bureau of Primary Health Care relative to smoking cessation or smoke-free or comorbidities associated with smoking, don't hesitate. We're very interested in it. And from the health center side, when you're talking to your project officer, or any of the folks, at HRSA, please emphasize smoking because, again, diabetes is very important, and I understand why it's important for the Bureau and for HRSA, but smoking, to me is a much greater problem, and one that deserves equal time and resources and attention. So, the next time Jim McCrae gives a speech, we're hoping he's going to talk about smoking and not just diabetes.
All right. Thank you so much, and have a great afternoon.
All right. Take care, guys.
Thank you.
Thank you.
Bye.
Bye.